So now I'd like to turn it back over to Dr. Martens to discuss improving communication amongst the interdisciplinary team.
Thank you. Yeah, I want to thank Dr. McCormick for giving us permission to be able to use that video. And if you are interested, if you go to YouTube, you'll see that he's put out quite a few similar sorts of videos, including a really interesting one that talks about what he would tell Tom Hanks about his diabetes, which was a very interesting and easy to understand description of some of the whole issues about diabetes. Now, as far as improving communications among the interdisciplinary team, when I saw that topic, my heart sank. I really don't know what to do with this. Certainly, I've seen problems that nurses have had. I've been at our long-term care facilities and watched some of the nurses standing, waiting on the phone 15 minutes for some doctor to answer the page and so forth, and that's frustrating. I can understand that. Unfortunately, sometimes it was even probably me that was they were waiting for. I certainly am not an expert on what to tell you to do about this, but as far as in long-term care facilities, there are some things that have seemed to be of use in terms of improving communication among the different disciplines. And in long-term care, it's the long-term care team conference. This is a time where you get together people from pharmacy, nursing, care aides, doctor, family, and even patient to be able to discuss some of the issues. You actually find out a chance to find out what exactly is the history on this patient. For us, many times this is a new resident for us. Many family doctors don't do long-term care work. As a result, we acquire these patients and we often have very little information. So it's a time to talk to the family and get some background. It's a time to look at drug reductions. How much trouble are they really having with their behavior? Do we really need this much of an antipsychotic? Can we cut it back? That sort of a thing. And it's also a time to build up rapport with the family and patient. Team conferences, the problems that we have is that there's an awful lot of problems with time. They take time. They're hard to organize. Talking to social workers who work in long-term care, it is a pain in the butt to try to find a time that everybody can make. And so we really have a problem getting to do it even once a year. The Ministry of Health approximately 2.5 years ago mandated that we should be doing it about 4 times a year. It's a great idea. I have no idea how we can ever do it. Okay, and my fear if we start forcing this sort of an issue, the benefits that, of the care team conference where you can sit down and discuss things will be lost because we'll be rushing through it so fast that no good will ever come of it. As far as what do we do in the future, I have some grave concerns about long-term care in the future in terms of how we're going to be able to manage this. There's a model that that was given to me about 6 months ago, and it was called Care by Design. This is a model out of Halifax where they've come up with a solution that seems to work for them in terms of dealing with care in long-term care facilities. And I was quite impressed with what I saw from it. If you want to get more information, if you Google Care by Design Halifax, you will find out all about it. They've got a large PDF that describes the whole program. They have been developing this program for approximately 12 years, and in it, a doctor is assigned to 1 floor, 1 unit, 25 residents, ballpark figure, and that's about all that you have. You have an assigned time once a week for half a day to go and see those residents and also to sit down and discuss with the nurse, the staff about what's going on. It's basically a care team conference once a week and staffing is organized so there's an extra person around to help be able to coordinate those sorts of things. It is a chance to really get to know the patients and actually spend time with them in a quality way. They also have paramedic support, and it's similar to what we're experimenting with in this health district, and they use evidence-based guidelines. which were really quite interesting to look at in terms of things such as diabetes, urinary tract infections. How do you diagnose it? What are your criteria? Very well researched. I actually went and compared some their guidelines with what was in different other organizations' recommendations, and they were following them quite closely. My concern is that we have to do something about long-term care. We are in a bit of a crisis here in this district. We have a bunch of aging physicians who are doing the majority of long-term care. Scary thought is I'm probably one of the youngest ones. And that's, my kids would be saying that's a shock. But the thing is, I'm concerned that when you have a doctor who's got 120, 200 residents, if that person was to become ill, retire, die, you've got a crisis. We can't absorb that amount of patients overnight. It just can't happen. The system that they have in Halifax is apparently working well, and from what they told me, they actually have a waiting list of physicians wanting to join the program. That is, to me, a very important thing. We are not seeing an awful lot of young physicians getting involved in long-term care work. And that's a concern as well, because what's going to happen in 10, 15 years, I don't know. I think we do need to change. And as I said, those are the times where we're able to get together and have some of these discussions and improve the communication. Now, I just wanted to take a minute to talk about some of the sources of information that I use to try to stay up and current on different things. Best Science Medicine podcast, that's a thing from Dr. McCormick. They have a course once a year in Vancouver. It's very nice to go to Vancouver for that course. It's usually in April. You get to see flowers blooming and so forth when it's still snow on the ground here. RX Files, very valuable resource. At one of the conferences in Vancouver, they were talking about their program that they're starting up for academic detailing. I went up to their booth to talk to them. They were discussing their program a bit, and then they saw my name tag and that I was from Saskatchewan. And their response was, "Oh, you got the RX file. Oh, you're way ahead of us." This is a tremendous resource that we've established in this province. We should be very, very proud of it and the work that you guys do. Info poems, short little things. They're approximately 6 minutes long. Cochrane Review podcasts as well. Bit dry, but okay. And then there was a book that I spent time reading a few years ago, A Bitter Pill by Dr. John Sloan. And it was about how we are failing our seniors in this day and age, how the system of healthcare just does not really address their needs. And we should be focusing on issues of comfort and function, and which one takes priority can vary from time to time. That's about what I've got here. And I know, Julia, you got some other things that you wanted to talk about in terms of other sources of information.
Absolutely. I think MedSask is an excellent resource that just not enough people know about. So perhaps you work maybe further up north, you work in isolation, maybe you're working nights, maybe you work in a one-man show. Sometimes it's nice to have a conversation with someone or just bounce an idea off someone when it comes to medications. And so it's always nice to be able to phone a friend. And sometimes it's nice to text them or maybe email them or fax them. And MedSask is a team of pharmacists available to support you and answer your drug-related questions 7 days a week. Monday to Friday, they're there 8 a.m. to midnight. And on the weekends, they're there 5 p.m. to midnight. And again, no question too big, no question too small. It can be patient-specific, or it can be a big overarching generalized question that perhaps you need for your own continuing education. What you'll get from this group of pharmacists is an evidence-based answer. They will research it and get back to you. If you've got something that's very urgent and needs an answer because you need to provide care based on that information, they will definitely get you an answer as soon as possible, if not immediately. But perhaps it's something you need for next week or just general knowledge, and they will perhaps provide it to you later on in the week. And you can also get it in writing or verbally. Their online submission allows you to enter patient-specific information, age, height, weight, medications, drugs. Perhaps you're just wondering if there's a drug interaction going on here, and you can send them that list and have them double check for you. But MedSask isn't just for you. It's for your patients and their families and their caregivers. And I've provided the healthcare provider phone numbers on the slide. And if you go to the website, you can get the healthcare consumer, they call it, information. And they do have a 1-800 number in the event you're outside Saskatoon to ensure you're not getting any long distance charges if you need to call them. But again, you can also text them, fax them, or email them. It's a great resource I strongly encourage you to check out. And they do have a lot of frequently asked questions also posted on their website. So that's all that I think we have. Anything you'd like to add before we throw it back to Michelle?
No, it's the questions I think that are going to be coming next, and looking forward to that.
Well, thank you very much. That has been just a fantastic presentation this morning. I know I've got lots of tips and made lots of notes on things that I can't wait to get trying.